Amiodarone has lots of toxic effects on different parts of the body. Mainly, it's toxic to the thyroid, the lungs, nerves, and others. First, let's see amiodarone thyroid toxicity. Amiodarone contains iodine and has four main effects on the thyroid, which depends on the baseline thyroid function test. The first is those who have normal baseline thyroid function test while amiodarone is started. In these patients, amiodarone inhibits the T4 to T3 diiodinase, which results in increased free T4, reduced T3, and increased TSH. This occurs in the first 3 to 6 months after starting amiodarone, and this is a benign and normal condition which doesn't need any intervention. The second group is baseline subclinical hypothyroidism. In these patients, excessive iodine delivered by amiodarone results in inhibition of thyroid hormone synthesis. These patients, amiodarone leads to hypothyroidism, which needs treatment with levothyroxine, but still amiodarone can be continued with closely monitoring thyroid function test. The third group is baseline autonomous nodule or subclinical Graves' disease. In these patients, thyroid autoregulation is disturbed, which results in excess iodine, resulting in excessive thyroid hormone synthesis, leading to hyperthyroidism. Treatment includes stopping the amiodarone. Due to the long half-life of amiodarone, the thyroid function test will not improve for a few months. Hyperthyroidism is treated with beta blockers and thionamide. Radioiodine therapy has no role in iodine overload status. Thyroidectomy may be necessary if thyrotoxicosis cannot be controlled with medical therapy. Fourth group is inflammatory thyroiditis. This is characterized by early hyperthyroidism followed by normalization of the thyroid function test in a few months. And diagnosis is suggested by elevated inflammatory markers including interleukin 6 and thyroid ultrasound showing hyperemia. And the treatment includes prednisolone for 1 month with subsequent tapering, and amiodarone can be continued. The other organ affected by amiodarone is the lung. Amiodarone leads to interstitial lung disease. Patients who has underlying lung disease before starting amiodarone and also in greater than 200 milligram per day dose of amiodarone increases the risk of interstitial lung disease. Amiodarone lung toxicity can present as febrile pneumonia, often simulates pulmonary edema and heart failure progression. The earliest and most sensitive abnormality is a reduction of diffusion capacity. Perform a lung function study before initiation of therapy and repeat it every year if symptoms occur. The treatment is stop amiodarone, initiate steroid. Amiodarone has also other toxicities including neuropathy, ataxia which is dose dependent, photosensitivity with blue skin discoloration, corneal microdeposits which is a universal finding and benign, and optic neuropathy which is rare, and also increased defibrillation threshold in